Hello everyone, I am Tanjumi Ivanyola from BSN 111A, and today I am going to demonstrate the parenteral administration such as the intradermal, subcutaneous, and intramuscular injection. So this demonstration is a medication that enters the body by injection through with tissue and circulatory system. So for the intradermal injection, check for the doctor's order on the patient's chart to ensure the medication of the client. Then greet the patient appropriately. Introduce yourself, verify the client using the true identifiers by asking her name and birthday, and then ask the client on how would they like to be called during the assessment. Then don't forget to establish a good rapport so that the patient won't feel uncomfortable during the procedure. Then explain to the patient on how they can participate during the assessment, and don't forget to provide opportunity to the patient so that they can raise their concerns. And of course, do not forget to perform hand washing to avoid the spreading of microorganisms and to prevent my patient and myself from cross-contamination. And after that, arrange your medication drug to the hypodermic tray with the corresponding drug so that you can prevent the confusion later on. Then apply clean gloves to reduce the risk of exposure to the blood. Good afternoon, ma'am. I am Tanjumi Ivanyola, your resident nurse for the day. Kindly state your complete name, please.
Princess Dayan Erolon.
Your birth date and civil status, please.
January 6, 2004, Sugar.
Okay, thank you very much, ma'am. But before we proceed, may I ask what should I call you?
Dayan.
Okay, ma'am Dayan. So in this administering of medication, we have three processes, which is the intradermal, subcutaneous, and intramuscular injection. But first, we're doing the intradermal injection. It is done for us to know if you have any allergies or to test simply for your sensitivity. So it will hurt a little because I'll be injecting it through the skin of your hand. So I need you to not move while injecting it so that we can prevent any injuries. Is that okay with you?
Yes, sir.
Okay.
So now we're done preparing the medication in the procedure of intradermal injection. So let's choose an injection site which is free from lesions or skin discolorations, which is below the anticubital space and above one hand above the wrist here. So place the patient's arm so that the elbow and forearm are supported by a flat surface. Then apply clean gloves. Then use an antiseptic swab. Start at the beginning with a circular motion outward, just about 2 to 5 centimeters. So since we're not advised to directly inject on the patient's skin, so we have improvised a tomato. We have our touch can here. Then remove the cup and hold the syringe between the thumb and forefinger of your dominant hand. Then level the needle pointing up. Then stretch the skin taut at the injection site by pulling gently by the thumb and forefingers at your non-dominant hand. Then slowly insert the needle. Then insert it slowly at a 5 to 15 degree angle until you feel the resistance, and then slowly inject the medication and feel the resistance. Then draw the needle at the same angle and pat dry it with a cotton. So don't forget to not massage the area. Then mark it with a black or blue ball pen. Then instruct the patient to not rub the wheel or the area. So, Ma'am Dayan, we're done. So, do not rub or erase the marked area of your skin.
Yes, nurse.
So, now assist the patient into a comfortable position. And don't forget to not use the needle again and put it in a trash can together with the cup. Then don't forget to perform hand washing.
So, how's your hand, ma'am? May I see your hand, please? So, let's document it first. So, as I can see, there's no red mark here. So, that means you don't have any allergies, which is, it's good. So, since you are unable to take the medication orally, we're going to proceed it through subcutaneous injection. So, let's start the procedure.
Yes, nurse.
So, let's determine which side we'll use. So, inspect for the area for bruising, inflammation, and edema through palpating the area to avoid the area that is tender. So, to make sure that you have the right size of the needle, use your thumb and forefinger to guess if skin fold of the tissue at the injection site. Then, measure the fold from top to bottom, then check if the needle is about half. So, place the patient in a comfortable sitting position, then ask the patient to relax the area that is about to inject. Okay, Ma'am Dayan, I need you to relax your arm as well as yourself, okay?
Okay, nurse.
Okay. So, don't forget to apply clean gloves and clean the site with the antiseptic swab. From a circular motion, starting from inner to upward. Then, let's remove the needle cup by pulling it straight long. Hold the syringe with the thumb and forefinger with the dominant hand as if you're holding a dart. Like this. Then, insert the needle quickly to 45 to 90 degrees. Then, release the pinched skin. Then, rest the dominant hand of the patient. Okay, Ma'am Dayan, I need you to hold it for a while, please. Okay. So, move your dominant hand at the end of the plunger and then slowly inject the medication over several seconds. Then withdraw or retain your drops with a syringe to keep it still for a while. Then quickly withdraw the needle and place a swab gauze on the site or putting a pressure on it, then apply it gently. But don't massage the area. So, document the procedure, then record the time and the amount of drug onto the medication sheet. Good evening, ma'am. I am Sandra May Ibanyola, your strength nurse for today. Can we take your complete name?
Princess Dayan Elma.
Your birth date and civil status, please?
January 6, 2004, Singal.
Okay, thank you very much, ma'am. But before we proceed, may I ask what should I call you?
Dayan.
Okay, Ma'am Dayan. So, we're done with the intramuscular injection. So, it means that I'll be injecting in your shoulder because it allows the medication to absorb quickly in your bloodstream. So, as you can see, we already closed the curtains and the door so that there's no other people that can see us during the procedure. So, let's start the procedure. Is that okay with you?
Yes, nurse.
Okay. So now, let's proceed to the medication. Select the appropriate site for the injection, which is the vastus lateralis and the deltoid muscle are the most possible area for the IM injection. So examine the integrity of the patient's muscle mass, then palpate the area for tenderness or if it's suitable for the injection. Then inspect the area for the bruising, inflammation, or edema. So if the skin shows bruises or inflammation, use the other side or the other side of the patient's shoulder. Then help the patient to sit comfortably and expose the area that only for the injection. Now disinfect the injection site in a circular pattern from inner to outer from about 2 to 5 inches by using the antiseptic swab. Then place a cotton ball from the 3rd to 4th finger of the non-dominant hand. Then remove the needle cup by pulling it upward. Then hold the syringe from your thumb and forefinger like you're holding a dart. So place the ulnar side of your non-dominant hand by pulling it up just below the injection site. So hold this. Manda yan. So hold this position until you pull the needle. So with the dominant hand, pierce the muscle at the 90 degrees angle to the skin. So continuing, pull the skin taut with your non-dominant hand. Then aspirate the syringe by pulling off the plunger with your non-dominant hand. So if blood appears, use another side and discard the syringe. So if no blood appears, then proceed. Then inject the medication in 1 ml at 20 seconds. Then wait for 20 seconds and slowly withdraw the needle. Then now, release the skin and place the cotton. Apply it gently, but do not massage the area. Then document the procedure.